Welcome back, everyone. Today, we're jumping right into part 8 of our masterclass. We're bridging that crucial gap between the complex clinical realities of the therapy floor and the strict compliance needed in your billing department. Whether you're a clinician delivering the care or a medical coder translating it into claims, mastering these core therapeutic procedures is absolutely essential. Okay, let's dive into this. On the agenda today, movement and manual interventions, aquatic therapy, gait training, massage therapy, documentation and time rules, and finally, a quick teaser for what's next. We've got a fantastic spectrum of care to look at today, from utilizing the physical properties of water resistance all the way to the highly specific manual kneading of soft tissues. Our goal is to flawlessly translate these movement-based and manual therapeutic interventions into rock-solid CPT codes. No more guesswork, and definitely no more denied claims. All right, Section 1, Aquatic Therapy, CPT 9713. Let's start in the water. The clinical reality of aquatic therapy is just totally different from land-based work. When a patient is in the pool, they're getting the benefits of buoyancy and joint offloading, which lets them do movements they simply might not tolerate on dry land. It's a fantastic therapeutic procedure for boosting aerobic capacity, improving flexibility, balance, and coordination, and even helping with gait in a really low-impact setting. But here is the absolutely crucial coding rule. CPT 97113 requires constant attendance and measurable one-on-one direct contact time. The time you count is the exact time you spend actively treating that patient using your skilled therapy, and you have to document that direct time clearly. Moving right along to Section 2, Gait Training, CPT 97116. Back on the clinic floor, gait training is so much more than just watching a patient walk, right? It's a highly skilled progression of functional ambulation, and this brilliantly illustrates exactly what auditors are looking for. If the goal is standing safely, your documentation needs to note specific impairment or functional testing. If you're progressing to walking or locomotion, you must augment the exact time spent and the specific skilled intervention you provided. And as that patient journeys toward independent stair climbing, you've got to detail any assistive device use and actually quantify their functional progress. If the notes don't show the therapist's unique skill in correcting and progressing that gait, the code simply won't survive an audit. Let's move to Section 3, Massage Therapy, CPT 97124. Coders and clinicians honestly get tripped up here all the time. We have to look at the exact physical techniques that make massage clinically different from other hands-on treatments. The CPT code for massage encompasses some highly specific techniques. First up is effleurage. Picture soothing, often circular strokes over the skin. Clinically speaking, this is your foundational technique. It's primarily used to relax the patient, melt away stress, and warm up those superficial muscles before deeper work begins. Then, building into that deeper intervention, we have petrissage. This is the actual kneading of the muscles, skin, and underlying tissues. The mechanical action here is designed to physically loosen up tense muscles and pump a significant amount of blood flow directly into the targeted area. It's a very targeted, skilled application of pressure. Finally, we have tappetment. This is the most active and vigorous technique of the bunch. It utilizes rapid, percussive tapping, slapping, and cupping of the massage area. The therapeutic goal here? To really engage, work, and strengthen those deep tissue muscles. Now, what's really interesting about this slide is how it sharply contrasts two codes that get mixed up all the time. Massage therapy 97124 versus manual therapy 97140. If the therapist is performing effleurage, petrissage, or tapetement to increase blood flow and relax muscles, that is massage for sure. However, if the therapist is performing myofascial release, joint mobilization, manual traction, or soft tissue mobilization to increase pain-free range of motion, that is manual therapy under 97140. Knowing this exact distinction is your absolute best defense against those common coding denials. Which brings us to Section 4, Documentation and Time Rules. Since all of these therapeutic procedures are time-based codes, they are heavily regulated by direct contact and exact time requirements. Your chronological flow has to look exactly like this. Step 1, exact times must be documented in the medical record. We are talking exact minutes of one-on-one direct patient contact. Step 2, you must identify each specific skilled intervention or modality provided to justify the code. And Step 3, you need to record objective measurements, like impairment and functional testing, to actually quantify your patient's progress. Best practices dictate that your documentation does a lot more than just list what happened. It has to establish that the patient fundamentally needs your unique skills as a therapist to improve their functioning. You do this by describing the complexities of their condition, noting any changes in their status relative to their goals, and providing hard outcome measures. If you're assessing their progress, or honestly even a lack of progress, and outlining clear plans for continuing or revising treatment, you are building an ironclad justification for your billing.
And finally, Section 5, Teaser and Final Takeaway.
We have covered a ton of ground today in this explainer, bridging clinical interventions in the water and on the clinic floor right to their precise, compliant CPT codes. Mastering these fine details, that's what separates good billers and clinicians from truly great ones. But our masterclass isn't over yet. Coming up in Part 9, we're taking a deep dive into manual therapy techniques under CPT 97140, and we'll unpack the very specific rules surrounding group therapy, CPT 97150. You definitely won't want to miss it. Until then, decode healthcare with Harshal.